Headaches are a common condition that has likely affected us all at some point in time. But don't worry, most headaches go away after a short period of time or with mild pain relievers like Advil or Tylenol. But consistent headaches and severe headaches can affect work and social life. So self-treatment may not always be the best option, especially because headaches may be symptoms secondary to a more serious condition. I'm Mike, your pharmacist. In this video, we will talk about what causes headaches, 3 major types of headaches, and the difference between them. First, what causes headaches? Headaches can be classified into 2 different categories: primary headaches and secondary headaches. Primary headaches are benign, recurrent headaches that have no underlying cause. Most headaches are primary headaches. While they may cause pain or disability, they are not necessarily dangerous. Secondary headaches are more serious. They are caused by a secondary disease like infection, brain bleed, head injury, or tumor. We will discuss what warning signs or red flags to look for that may indicate secondary headaches towards the end of this video. Now, about 90% of headaches are primary headaches. So what causes primary headaches? Now, it is believed that dilation or the swelling of vessels in the brain are the cause. It could also be the activation of a specific set of neurons called the trigeminal sensory nerves. But there are certain triggers such as stress and anxiety. This is one of the most significant triggers. Managing stress is one of the most effective ways to managing recurrent headaches. There's also certain foods that can bring on headaches, like aged cheese, cured meats, chocolate, or red wine. A cold or flu can also bring on a headache. The pressure buildup can lead to sinus headaches. And of course, caffeine, either increased consumption or decreasing the consumption suddenly, can cause headaches. Hormones can also cause headaches. For example, headaches are more common during monthly menstrual period in women. Chemicals like MSG in food can also lead to headaches. And there's also environmental factors like the changes in weather, bright lights, strong odors, and cigarette smoke. You can also get headaches from too much or too little sleep. You can also get headaches from not eating regularly. Every person has different triggers. If you are able to keep a diary about your headaches, it can act as a powerful tool for health clinicians to help them find out what's causing them. The most common type of headache is a tension type headache. It is the most common reason people buy over-the-counter analgesics. Tension headache pain is usually mild to moderate in severity. The location is on both sides of the head. It is bilateral pain. The characteristic of the pain, it often feels like there's a tightness or a pressure on your head. It's almost as if there's a band around your head. And then the associated symptoms, generally there are no associated symptoms. Tension headaches generally do not require medical attention. They usually go away on their own or can be treated with mild pain relievers like aspirin, Tylenol, or Advil. The second type of headache is more serious, and these are called migraines. Migraine headache pain is moderate to severe. The location is unilateral. It usually occurs on one side of the head rather than on both sides. The pain is characterized to have a gradual onset, and the pain increases in intensity, and it's described as throbbing or radiating pain. It lasts about 4 to 72 hours, and it does have associated symptoms. They can be associated with nausea and vomiting or both, and they can cause sensitivity to light and sound, and there may also be this visual sensation present right before the headache. These sensations appear as flashes or bursts of light, zigzag lines, or dark spots surrounded by light. This is called an aura. Physical activity tends to make migraine headache pain worse, and migraines are more common in women than in men. Now there's a third type of headache that is often under-recognized, and these are called medication overuse headaches. It's caused by using pain relievers like aspirin, ibuprofen, naproxen, and acetaminophen for more than 15 days per month, using products containing codeine or caffeine more than 10 days a month, or consistent use of combination products that contain opiates or barbiturates. Triptans and orgonamine derivatives, these are prescription medications that are actually used to treat migraines, but if you use those too much, more than 10 days in a month, they can also cause medication overuse headaches as well. Headaches can be secondary to more serious medical complications, so ask yourself a few questions before trying to self-treat. Here are the red flags to look out for. Did the headache come on suddenly, and does it feel like the worst headache of your life? Are there any changes in balance, consciousness, mental status, or in your vision? Are there signs of fever and nausea or vomiting that's not associated with a migraine? Do you have one-sided weakness, like weakness on one side of your face or weakness in one arm? If the answer to any of these questions is yes, then you need to go to the emergency room or urgent care to rule out more serious causes like bleeding in the brain, which is also known as a hemorrhage, or a blockage or a partial blockage in blood vessels in the brain, which is also known as a stroke or a transient ischemic attack, TIA. It could also be an infection like meningitis. And lastly, it could be a brain lesion such as a tumor. When to see your doctor? When you have more than 15 episodes in a month, if there is a change in headache pattern, like getting headaches more frequently, or a headache that is progressively getting worse, onset of headaches with exercise or sexual activity, if you have headaches that wake you up in the middle of the night or have headaches upon awakening, if your headaches are moderate to severe and interfere with your quality of life, you may need prescription therapy. In my next video, I will discuss the different options for treating headaches, migraines, and medication overuse headaches. I'm Mike, your pharmacist. Thank you for joining me today, and subscribe for more health information videos.